testicles when you take it out and you leave the normal one on the other side. That testicle's at risk too, even though it's not crypt organ. So what's the moral of this story? The moral of the story is that whether it's in and whether it's out and you've left behind a normal one, you have to have your testicles examined once a year to make sure that you don't develop a seminoma, which is a germ cell tumor. Now I've got an analogy for you that will help you. As you know, in Turner syndrome, they are infertile. They have menopause before they have menarche, because by 2 years of age, they have no follicles at all in their ovaries. And they call that a street gonad. So it's an ovary without any follicles. It's called a street gonad. Can we make that analogous to a crypt organ testis? Let's do it. And so just like the crypt organ testis predisposes to seminomas, which is a germ cell tumor, so does the street gonad predispose to a germ cell tumor, except in a woman. We don't call them seminomas, we call them dysgerminomas. So it's a very, very good correlation to remember. See, that's why patients that have been diagnosed with Turner syndrome, they remove surgically both ovaries because of the great risk. Okay? They don't keep them in there because they will develop cancer. Okay, orchitis we've talked about in reference to months, so we don't need to talk about. This is kind of interesting. You always hear this. Epididymitis, less than 35, anti-bacterial gonorrhea, chlamydia, greater than 35, Pseudomonas E. coli. Is that implying that people over 35 don't get sexually transmitted disease? It's kind of weird, but apparently it holds true. And it's been asked many, many times on examinations. Varicocele big time on exams because there's an anatomy relationship. What side are those bag of worms located on? The left. Why is that? Because the spermatic vein on the left is connected to the left renal vein, whereas the spermatic vein on the right is connected to the inferior vena cava. And because of that abnormality, the pressures are greater, and you get a varicocele on the left that produces increased heat, and it is one of the most common causes of